There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. On today's episode, we're going to be talking about a feature of the children's system of care that maybe not every family comes into contact with, but the families that do desperately need the information. We're talking today about the transition for families with children with intellectual and developmental disabilities from the children's system of care into the adult system. At DCF, we have services and supports that are available to those families to make that transition just a little bit easier and a little bit smoother. Today, we're going to be talking with 3 guests who are a part of that process, and I'll turn it over to them to introduce themselves.
Good afternoon. My name is Patricia Burnaby, and I work for the Children's System of Care, or you might have heard CSOC, and I am a DCF DDD transition specialist for families and case managers.
Hi, my name is Denise Padron. I am the guardianship liaison for DCF CSOC.
Hello, my name is Lourdes Torres. I'm the supervisor in the Office of Constituent Affairs. So I help to oversee the transition services and also the special services for children with intellectual developmental disabilities.
Great. Pat, Denise, Lourdes, thank you so much for joining us today on DCF on the Air.
Thank you. Thanks for having us.
Thanks for having you.
So I'd like to start off asking about what are some of the supports that are available for youth, for families that have intellectual and developmental disabilities through the children's system of care?
Okay. So some of the supports that we have are specifically for children with intellectual developmental disabilities and also for any child with mental health or behavioral health concerns or substance abuse challenges. So just for the services for all the children in New Jersey who have any challenges would be our care management organizations, which offers care management services for kids with higher acuity behavioral health issues. We have our mobile response services, which are more intensive mobile services that go out within 72 hours if a child or family is in crisis. And then we have our family support organizations that offer family support through this process or accessing services in their community. So specifically for children with intellectual developmental disabilities, we have our family support services, which are respite care services, camp services, educational advocacy services, and assistive technology services. We also have, and intensive in-home services. So these could be intensive in-home behavioral health services, such as ABA services for youth with autism or any other developmental disabilities. We have intensive in-home clinical services. So this would be more like talk therapy for youth with intellectual developmental disabilities. And we have our ISS or individual support skill services, which are more services geared towards learning their ADLs or their activities of daily living. So it could be taking youth out to the community to be able to learn how to purchase things on their own, how to take the bus, or even just how to interact with others in the community.
Yeah.
So those are specific to youth with IDD.
Great. Thank you so much. And I know because the children's system of care, it's really built around a systems approach. It really is a comprehensive system. So all of those supports that are available, if you're coming to this system as a family with a youth that has IDD, or you're coming as a family with a youth that might have a substance use issue, or all of those services are available across the board, but there are specific services for that IDD population.
Yes. So youth with IDD can access all those services, but the ones that are specific to youth with IDD are the family support services and then intensive in-home services.
Okay, great.
Right. I mean, I would say also that our youth, because we do cover youth from 0 to 21, but if we have youth that are 0 to 3, when we get calls like that, we refer them to early intervention services, which is in the Department of Health.
Yep.
From there, that support there is basically just for respite, because then they would be using one of the regional maternal health centers to obtain services and DD services at one of these places through testing and things. So,
But I think that's a really good call out, though, because it really points to the fact that, and I mean, to the point of what we're talking about today, the being able to navigate all these different systems, that there's support set up for families across the entirety of state government. But families might not know how to access those services or where to go next.
Okay.
And I think that, that's a great call out, that we're connecting back to the Department of Health for early intervention, because that's really what the system is intended to do. We're helping families connect to those services that they're eligible for and that they need to help their child thrive.
Exactly.
I was just going to say, I think that brings a good point. So all these services that we talked about are accessible through Perform Care, which is our contracted system administrator. So all families would have to do is call Perform Care. We can give that information out, later on, or access their website to see the list of services that are available.
I think the number is 1-877-652-7624.
That's right. Yeah.
Yeah.
And then a family, if they have a child that's in crisis, they can contact Perform Care 24/7 at 365 days a week, or 365 days a year.
Great. Sometimes it feels like there's 365 days.
Yes.
I know this is one of those Mondays that feels like 365 days in a blue day. But going back to this idea of services available across state government, and through the Children's System of Care, we support children and youth 0 to 21. After 21, they age into the adult systems. What are some of the differences between the children's system of care and the adult system for individuals with intellectual and developmental disabilities?
Well, if you look at where we are, we have those. When our youth came over in 2013, the youth, and that was a thing done between the two commissioners and the governor, and they thought it was a good idea that the youth with developmental disabilities would be able to get case management through DCF, when DCF came into existence from DHS back in 2006. So parents said, gee, I'd really like to have services geared toward my child that's maybe 10 years old or 17 years old. So with us, we're the 0 to 21, and the majority, almost all the youth, are involved in the Department of Education, DOE. So all of their services, and I'd say 95% of those with developmental disabilities have what's called an IEP, or an individual education plan. So the services that they're getting within the school during the day, say 7 to 3, OT, or occupational therapy, speech therapy, maybe they have full-time inclusion in a self-contained classroom and augmented with a special education teacher. They are getting those services through the school. Then after 3 o'clock, they would be able to get services maybe through us, additional services. So that's one difference. And then when you move to DDD, after 21, you go into the adult world, which are similar services, but we could go into it, but you get what's called more a support coordination agency and a support coordinator that coordinates your services. So you get like a kind of a new DDD case manager that would help you with similar services.
Great. So
they are different, what you're getting in the school, and it's hard for these families, and that's why we talk with them, because they're coming from this kind of a self-contained, nurturing environment in the school. Not that they're not in the real world. In the adult world, it's not nurturing, but it's very different, even down to bus drivers and bus aides. The parents form relationships with teachers and these people all their lives up till 21, because most IEPs, if you do have an IEP, you do have that option to continue with DD services till 21 years old, which is why we serve not just 0 to 18, but 0 to 21. And then what we do as a team is we help those families to transition to the adult world in a seamless way as much as we can, because of what's involved with the new application for adulthood. And then the biggest thing is adult Medicaid that is needed, because DDD now moves to a fee-for-service. So adult Medicaid is what is needed, and we help with our DCPMP specialists, and we work with them.
Can you talk about the difference between a fee-for-service versus what we have through the Children's System of Care?
The fee-for-service is basically a Medicaid platform that's set up that is basically the money follows the child. I mean, the money follows the adult now.
Sure.
Whereas in DCF, and I think it's similar in CSOC services, the Medicaid is specific to that child also. But the Medicaid, a lot of it, I believe, goes to the provider.
Mm-hmm.
And then they oversee the group of CSOC children Medicaid-wise. But in DDD world, the money goes to that individual adult, and they are rated by budget tier systems and how much money they would get for, say, vocational training, employment and vocational, transportation. Everything is itemized out for that adult, and it's in a budget tier system. So it's a very different world when a family goes from the school environment into the adult world, and they get nervous, like I would, the same way. I had a child with an IEP. It's very nerve-wracking at times, and you get frustrated to say, oh my gosh, I have to move to another whole new system. So our whole team, and it's not just the three of us, we have Medicaid specialists that we work with within CSOC and DCF, and we just try to help that parent, and especially case managers, because DCP&P case managers, they're pretty busy. So we're there to support them with whatever they need, which is why we mentioned there's emails that case managers can email for more information, because we're finding every individual youth has a different circumstance.
Yeah.
Mm-hmm.
And what we'll do at the end of the podcast episode, we'll put those emails on screen. So if you're watching,
Great.
we'll put them on screen. But we'll also bake it into the comments for the episode so that people can access it that way as well.
Great.
Okay.
It's great.
So my sense is that the difference really comes down to, from the children's system of care, it's probably a little more growth oriented, whereas on the adult side, it's a little more stability oriented. Is that a good characterization, or is that a little more?
Yeah.
No, it is. And working in, I would say.
Yeah. And I was going to say, just thinking about it, like the children's system of care is very family-centered and
Yes.
family-oriented as well.
Yes.
Yeah.
So whereas I feel like the adult system is a little bit more independent, right? Like the youth is getting independent, the youth is kind of going on their own, being able to find employment. Whereas the children's system of care, we provide the youth services, but we also want to make sure that the family is receiving services and the support that they need through like our wraparound model with services.
Yeah.
Yes, because we're finding at DCF that within CSOC that we have basically 2 to 3 buckets of type of youth. The first one we're always talking about, we have our at-home youth.
Mhm.
So that is a lot of work, and a lot of supports are needed in those situations. Then we have our youth that are case managed through our CMOs, and a lot of the youth at DCF have both DCP&P and CMO case management. And then we have a third bucket of youth that are just FSS or family support services, receiving family support services. So it can get busy. And in those out of home, they are our most intensive children. And one of the gifts that we have here is we do what's called roundtables. And they are done by everybody on the team meets about that youth. It could be the guardian. It could be the DAGs, if the DAGs are involved with DCP&P. It's the therapists. It's the provider. It's the youth themselves, case management, DCP&P, the DDD intake office. And it's a great way for our out-of-home youth to be able to seamlessly transition over to DDD. So they get a lot of attention, and their transition is pretty good, because DDD needs to know, does this youth need additional transition residential care? So we have
So an example might be if a youth is living in a medical facility. So it kind of notifies DDD that this individual is going to need a higher level of care versus someone that might need a community-based program, or maybe a supervised living apartment or a group home setting.
And I think we may have said it at one point, but I'm just going to do a little bit of translation. because I think that's one of the shorthands that we fall into.
Mhm.
But DDD is the Division of Developmental Disabilities. That's within the Department of Human Services. And that's the adult system. Essentially, when we say DDD, we're talking about the adult system. CSOC, Children's System of Care, that's DCF, that's the children's system. But I know that's, we
Acronyms are
Yes,
love our
state
all over the
government.
place.
It's state government. It happens.
in all of
Yeah.
state government. All
And then
the
I think another
acronyms.
plug for CSOC, the difference between children's services and then adult services is that CSOC and the care management organizations are there to support the caregiver, whether it's respite, education, advocacy, making sure that the child can be safe and be successful and sustainable at home in
Sure.
the community.
Yeah. No, I got to imagine for parents that are supporting children with intellectual and developmental disabilities, there's a lot of, I guess there's that need for support, because I can imagine it feels very isolating at times. I know we also have Mom to Mom, which is another resource that's contracted through DCF, but is a peer support where moms can call in, moms and dads, it's just not just moms, but that's what the name of the service is, and can call in and talk to somebody who's been in their shoes and can kind of walk them through what they might need to do or provide some reassurance. So I think that's another really good call out.
Our other one is
The family support organization. So it's essentially a peer
child.
Yeah.
If you wanted to mention that,
We also have, so we collaborate a lot with other
Collaborate a lot.
agencies, like the Department of Health, we have the Special Child Health Services. So for them, the child doesn't have to have developmental disability eligibility through the children's system of care, but they can have a diagnosis or the parent can have some questions regarding maybe a possible diagnosis. They can reach out to the Special Child Health Services. There's one in each county, and they can help them like with case management. So it could be with educational, medical, behavioral health supports. And a lot of times we connect with them because they'll reach out to us saying a family is in need of our services as well. So then we can reach out to the families.
Great.
and then we have our youth. A lot of them, we would just say 50%. Those that have developmental disabilities or DD, that they were originally with DHS, as many of you might know. That again, we mentioned the children that were identified or declared DD eligible came from DHS, right? And then again, as we mentioned before, DCF was formed, kind of spun off from DHS in 2006.
Yep.
And then we we had the children about in 2012. So you're looking at maybe 50% of the children or the youth that we deal with were declared DD eligible years ago within the system. And then our other 50% are those declared by Perform Care. So they're newly DD through our Perform Care system. So they are really looking for, both areas are really looking for support, especially for the DD, the youth that were DDD, Division of Developmental Disabilities, because they think that they're getting a new case manager when they come here. And it's different. It's a little different. And we try to work and empower the parents to become kind of their case manager for their child. Teach them some advocacy skills, especially like you mentioned, the FSOs. Teach them advocacy, edit.
No, we're keeping that in.
Advocacy skills, so that they, when this all happens, that they'll be able to help their child along and become empowered themselves that they can do this.
Yeah.
So.
And I think so my interactions with the commissioner, going around doing some of the listening tours, accompanying her on some of that, what I've found is that parents of children and youth with intellectual and developmental disabilities tend to be probably the most engaged advocates. And I think that's partly because they have to.
Yes.
But it's just, they have a better understanding of the system than I do.
They do.
And they come with really robust questions, and they They have their specific situations. They know what's available. They know what they need.
Yeah.
So I think that whatever we're doing to support advocacy among this community, it's working. But I think it also means that as we're engaging with those families, we almost have to step up our game a little bit, right?
Yes.
Because they're coming to the table. They know what they want. They know what their child needs, and they're going to advocate very strongly for that. So as we're helping them kind of move through this transition process, being mindful of these are the services that are available, these are the supports that are available, and connecting them to that, I think it's such a vital part of the services that we offer to the families that we support.
Very much so. And especially the ones that come through the DD Ombudsman, those offices. He's very active within the community, and he'll refer families to us. And we also work a lot with the New Jersey Council of Developmental Disabilities and their regional family support planning councils. We always encourage those. So our little group is very busy because we're also interacting with case management all the time.
Yep.
And we're finding our DCP&P youth the most vulnerable. So we really work together to try to help support that case manager out in the community as they're going every day and working with families.
Yeah.
So getting those, okay, here's the DDD application. You need this for adulthood. Let's work with you on our Medicaid, and our Medicaid specialists within there. They can, we have DCF has a Social Security Administrator liaison, so they can reach out and talk to those about those youth and where they are with what's called RSDI, which is retirement. They don't have to worry about retirement income, but disability income, survivor income. So all of our youth, if you had to look at them within the system, every single one of them has a different situation and a different need a different type of Medicaid, depending on what it is, whether it's federal Medicaid or state Medicaid. So that's what we help them traverse through this whole thing.
Great. And I think you started to answer my next question. So no, I won't penalize you for that. You're jumping ahead. But you mentioned the roundtables. You mentioned that we have individuals within the department that can advocate on behalf of families with our federal partners, with our state partners. But I'm wondering, because I know that the supports that are available for transition are relatively new within the children's system of care. Some of the supports are relatively new. If you can talk a little bit about what that transition support looks like.
Our young people, when they're in high school, that's when we want to start having conversations, right? What does your adulthood look like? Just because you have an intellectual developmental disability doesn't mean you can't go to college. Or are you interested in gaining a job? Where do you plan on living? Are you able to manage your own finances? Can you make your own decisions? So beginning to have those conversations early on is super important to kind of project them to be successful and independent in their life. So with the DCF, with our care management organizations, we want to make sure we're teaming with the child study team and making sure that there's goals in their IEPs, the individualized educational plan, to help prepare them to transition. And as Pat mentioned before, we have designated email boxes. So Pat helps youth that are between 18, 21 plus, transitioning from CSOC, DCF to adult services. I cover guardianship liaison. So if there's any questions about guardianship, what that looks like, again, understanding Medicaid. So there's a lot of different moving parts when families are applying to DDD, that they have to have that adult Medicaid eligibility before they even apply.
Sure.
So just making sure that they understand all the different parts.
And there are different eligibility standards for the adult Medicaid versus children's system of care?
Yes.
Yeah. What are some of those differences as far as eligibility?
Well, if you're talking about what?
So I would say with CSOC Perform Here, it's a four-part application. The application's available online. So it's based off of age, diagnosis, They have to be either the parent guardian needs to be a New Jersey resident or the child. See what else?
Citizenship.
And then they have to meet 3 out of 7 functional limitations, such as receptive, expressive language, self-care, learning, self-direction, capacity for independent living, economic self-sufficiency, and mobility.
And for the Medicaid piece, which that all falls under, for the adults, it's similar, but when you turn 18, that's why we've tried to focus on that 18 to 21-year-old, because in the United States, most states, when you turn 18, and New Jersey's one of them, you become an adult.
Mm-hmm.
So the way you have to apply for Medicaid, you're now applying as an adult and not a child, like you have a parent. That usually when you're applying for Medicaid or New Jersey Family Care, I should say that, New Jersey Family Care, the parent is applying for the child, and then the child falls under the parent's income. But when they are 18, our youth are adults now, so they can apply as individuals. And that's where that sticking point is that if you go into the system, that you can go into the DCF system, whether it's Spirit or we have a cyber system, we can see the type of Medicaid that a youth has. And a lot of especially our DCP&P youth are maybe in resource care. So they have a different type of Medicaid also. And then we say, oh, they have 600 and 620. And, there's sheets this thick of hundreds and hundreds of Medicaid codes. So we deal with a specific amount, and there's Medicaid that's for youth that are under 18. There's a Medicaid code for youth that are 18 to 19. There's a Medicaid code for 18 to 21. There's all different codes, and we help the case managers, we help families to help them determine what type of Medicaid they need.
Mm-hmm.
But we're working with our DCF Medicaid specialists.
So on the short end of that, because it's super complicated with all the codes, and it's always changing. So we want to make sure that they have SSI, Social Security, income, ABD, that's aged, blind, disabled Medicaid, or New Jersey Family Care. So they need to have one of those 3 types when they're applying for DDD, adult services.
But just know there's DCF specialists to help you with that.
Yes.
I was going to say, this process seems so clear. I don't see why you left it out.
Because it gets confusing. And just so you know, if you're going into DDD world, there's a DDD Medicaid help desk.
Mm-hmm.
And that's another, email that we can help provide. There's a DDD transition to adulthood that DDD provides, and we work with them all the time.
So there's so many resources out there. So just making sure everyone's aware, which one to use when they're in that situation.
I would say too, Lourdes, because she oversees our CSOC director box.
Yes, so that's all inquiries.
Yes, which our leadership is always, our executive leadership is always saying, whenever you go somewhere, please use the CSOC director mailbox. And we were going to also give you that that you can use within this presentation. You really handle all those that are that 0 to 8 to 17 and a half, and make sure that they have their services of things.
Yeah, because our CSOC director mailbox, so we handle all inquiries regarding any children's system of care services. So we really can help guide families if they have any questions about who to reach out to, where to go for resources. So that would be important.
You're working with DCF advocacy every day, that office. So our offices, we're working with adoption.
It overlaps pretty much everything of DCF and then other stakeholders in the community.
The Office of Adolescent Services, the adolescent units within the local offices. So we can get kind of busy with our little unit.
Yeah, it sounds like it.
Yeah, with Melinda Carnesal and Alex Encarcione. They oversee us, and they'll just email and say, hey, can you help here? Hey, this is an email I received. Can you help? So they're very much telling us all the time what's going on, but we kind of are doing the work every day. So that's why we're here.
Yeah, so then with like DCF, CSOC, we kind of triage any inquiries So then we'll kind of review what's going on, who is already connected, who else needs to be involved, and kind of move things along so it's a smooth transition.
Yeah. And it's not just about the transition, but any questions at any point come through that director's inbox.
Yes,
right?
Yes.
questions at any point. Even if you're not connected with us yet,
Yes.
you can reach out if you have questions and we can guide you through the process. Usually I'll respond and give you information about what's next.
Yeah.
Yep.
Yeah.
So you'd mentioned the timeline. That typically we're going to start these conversations when the child or youth is in high school. Start planning ahead and making sure that we have all of the goals and all that figured out. What is the actual transition timeline? Because I know we're still supporting up to age 21.
Right.
But from 18 to 21,
So if a youth is DD eligible through CSOC Perform Care, they can still access services through CSOC until age 21.
okay.
So if a family is linked to a care management organization or services through Perform Care, they're good to go again until age 21. But then let's say if a family is not, the youth is not DD eligible and they're age 18, then we would encourage them to actually apply to DDD. So if they have that adult DDD eligibility, they can still access services through CSOC Perform Care until age 21, if that makes sense.
So you're saying like in a situation where they're just applying at 18,
Yes.
at that point they're essentially in the adult system, but they would still access services through the
Yes. So DDD is aware of the young person that they have an intellectual developmental disability. So they're on their radar, but they would access our services through DCF CSOC until age 21. Because DDD will not begin to offer services until they're actually turn age 21.
Because they are still within the Department of Education. They still are under an IEP, an individual education plan. And within that, as you mentioned, the big thing in an IEP, which is what we really suggest to families and caseworkers, talk to the child study team, because every child that has an IEP within a school has a case manager, and they are on the child study team. And that case manager could be the school psychologist, it could be the LDTC, which is the Learning Disabilities Teacher Consultant, or it could be the social worker. And we really encourage, again, families and caseworkers to say, have you done the transition pages? Because within an IEP, it could be this thick, but there's a section in there on transition. And what are you going to, what do you feel we should refer the families to? So we encourage families and caseworkers to talk to their child study teams and say, hey, can we fill out the transition form? What do I need to get to DDD? What do I need for transportation? What do I need to maybe look at employment? Can I get a referral to DVRS? This is another one, the Department of Labor, DVRS, which is Division of Vocational and Rehabilitation Services, sits within the Department of Labor. And we ask the child study team to help them get that form, get it signed, and start working on maybe your child would like to work, like you mentioned, and be a job and have a job coach. So they are the types of things that we think would help families because, and as you mentioned, because they are with us until 21. They can't go to DDD early yet. So
Go ahead. No, I was just going to mention that you did touch upon, that you have to apply. If you're 18 and you've never received DD eligibility, you have to apply through DDD. But even if you do have developmental disability eligibility with the children's system of care, you have to apply for developmental disability eligibility through DDD before you turn 21. So typically, I think usually closer to the age of 21 is they would do a short application through DDD in order to access those services, even while they're still getting services with the children's system of care.
So then I'll backtrack. So there's two different types of applications through DDD. There's a short application, and then there's a full application. So completing a short application would be a youth is already determined DD eligible through the children's system of care. So then once when they turn 18, they would complete the short application, and that's actually the young person completing it. So if a family member caregivers assisting them, they would acknowledge that on the application.
Okay.
And then the full application is for a young person that's never been DD eligible through the children's system of care.
You mentioned the parent helping them to fill out the application, and that brings up the idea for me of the guardianship, because I know that guardianship is a part of this process for some families. Not everyone is designating a guardian at the time of transition, but I'm wondering, what does guardianship look like for those families that do need that service?
Yeah, definitely. So again, once when a young person turns 18 in the state of New Jersey, they're an adult. They can make their own decisions legally. So again, not all young people need a guardian once when they're 18, but there's different options. So let's say if the individual is living at home with either a caregiver or a parent and they are interested in becoming their guardian, they can contact their county surrogate's office to learn all of the how-tos. Usually it's appointment only. So if you go to newjerseycourt.gov, you can get all the information for the surrogate office. And then either the caregiver or parent would complete all of the paperwork, submit it to the court, and then there would be court proceedings. If a parent or caregiver would like assistance completing that information, they can either have a nonprofit attorney or a private attorney assist them. So that's one option. Another option is for young people, let's say, that have been in DCP&P custody in a resource home. There's limited or no natural supports involved. They can apply for a New Jersey state-appointed guardian. So that's connected through the Department of Human Services, the Bureau of Guardianship Services. So a shorthand, we call it a BGS guardian. So for that, it's for a unique population, and there's different criteria to be eligible. So we want to make sure first that they're DD eligible, that they have that adult Medicaid eligibility that Pat was talking about. They have limited or natural supports, and that their plan is to live in a New Jersey DD residential setting. So those are our 3 different options.
But for those that don't go through the Bureau of Guardianship Services, it doesn't necessarily, a guardian doesn't necessarily have to be a parent, right?
Correct.
It could be a sibling, could be aunt, uncle. So almost like the same concept that we have in the child protective side of things with kinship. That your guardian isn't necessarily always your parent, but it's somebody that has
just to help guide decisions. Also, being a guardian doesn't necessarily mean that the young person has to live with you. The individual, they can still live on their own, depending on what setting that looks like. But they're just there to provide guidance.
Yeah, we do get a lot of emails from especially DCP&P workers, CMO workers, and saying, oh, this child's 19 and they need a guardian. And we're like, okay, first question. Do they live at home? Do they have parents? Yes. Well, we say, well, they're not eligible for a BGS guardian because they do have someone that can support their decisions. So the ones that we really help with through the BGS is those that have no family, no, maybe in hospital, and just really have no one to speak for them. And then we do this application, which is very extensive. And then we submit it to BGS. And then the Bureau of Guardianship Services has their own investigative team. They have their own DAG.
Right. And then they have to rule out that there are no natural supports able to step in. And the process could take up to a year. So it's unfortunately not a quick fix if DCP&P is looking for someone to kind of step in.
And that's when we encourage DCP&P workers to say, listen, you can be a guardian to this youth. Basically, not that you're the parent, but you're helping them because they are their own guardian at 18 years old. You can help them with vocational decisions, educational decisions, societal divisions. I mean, they want to be a regular teen. They want to learn how to drive. Maybe they want to date. Maybe they want to marry somebody. These are things that case managers can help youth make these decisions with. And so we always encourage even medical decisions. And I know you get nervous, everybody would be nervous with that type of thing. But if you're working in consult with their doctors and nurses and hospitals, those decisions case managers can work with to help make those decisions. So, I mean, there's like a case that came up, and we had a, I don't know if I'm jumping ahead there. Is it edit?
It's okay.
No. So, just to bring you through a case that came up, we got a call and it was from another collaborative organization we work with. We mentioned a lot of them, New Jersey ARC, and we get emails from them, and they have a youth that is 19 years old, and the mother passed away, and now they're in the hospital, this youth. So we said, Pat, then they were asking, can your team help us? So they had the social workers on there from the hospital on there, Robert Wood, and they emailed us and said, help. So we said, okay, here, give us some more details and the name, the date of birth, that type of thing, and let's see if they're in the system. And it turned out they had been with DCPMP years and years ago, but we didn't know why, and it was what's called a restricted case. So then our DCPMP people helped us out and said, you know what, here are just the names of the people that had been in their background, and they're safe. So we worked with the social workers at Robert Wood, and they reached out to these relatives, and the relatives said, yes, let us come visit. Let us, we'll work on guardianship or adopt them.
Yeah.
So we said, okay, you need to get in the system. So we sent them what's called the clinical summary template. That is on the Perform Care website. The social workers filled that out, and that was a way to get into our system, into the DCF system, because they're 19. They can't go back to DCPMP anymore.
Yeah.
So they got connected through a CMO. CMO goes out to the hospital, does all the interviewing, helps them with the DDD app, the Medicaid app, and then connected with the relatives, the aunt and uncle, and now they would like to adopt the youth, because they were looking to us for guardianship, the hospital. So we helped them understand or suggest to them how to get a temporary guardian through the courts. And then they were able to connect with the Bureau of Guardianship Services if need be.
Yeah.
So there's a lot of cases that come through us, and they can be complicated and lots of different circumstances, but we try to help them navigate.
Now, quick question from what you said. You'd mentioned that in this particular case, the uncle wanted to adopt. Do you have to adopt to be a guardian?
No.
Or is that it's a separate process?
It's a separate process. And they just wanted to be, said, we're willing to be a guardian right now.
Yeah.
Because the youth was nonverbal. He had a high level of autism, and the case social workers at the hospital were trying to do all the navigating for them. And that's when New Jersey ARC reached out to us and said, can you help the social workers navigate this process also?
Sure.
So, they said they'd be willing to be a guardian for them. So they were able to step in and help make decisions also.
I just wanted to make a quick point, because I know they were mentioning about the Bureau of Guardianship Services and BGS. So that's like a very small population that actually requires this. So I don't want everybody to think like, oh, we can't reach out because we don't fit the criteria.
Right.
So like Denise said, that there is pro se guardianship, and there's also supported decision making.
Yes.
Where, parents can actually take guardianship in certain aspects of the youth's lives, because maybe they can make certain decisions about some things, but not other things. So there's another avenue, and families are welcome to reach out to us if they need any guidance on that as well.
So then with supportive decision making, that would be power of attorney or a medical directive. So if families or caseworkers have questions about that, they're welcome to email, and then we have handouts that we can provide.
Right. And they're put through the Department of Health, the medical directives. We try to send the forms to them and things. And Lourdes mentioned, and you mentioned pro se. Pro se is, again, and it's a Latin term that means on your own.
Yeah.
So we always encourage families, if it's a simple guardianship, you can do this on your own.
Yeah, you don't need a
Here
court.
is the 10559 forms that we're going to send you, and you can work, like Denise had mentioned, there's nonprofit agencies. Another collaborative partner is CHLP, Community Health Law Project. They can maybe assist the family to help with the pro se guardianship, or another collaborative partner, SCARC, Sussex County, the ARC up there. They have their own guardianship foundation that can help you with what's called pro se applications if the parent is willing to do this on their own, which they can do this on their own with the psychologicals and the reports they get back from doctors' offices.
Yeah, and then everything like that Pat's talking about, it's listed online through the New Jersey court.gov website. So all of the court documents are there. It outlines what supporting medical information that you need. And again, it's at a reduced court fees. So you wouldn't
get
have
the
to
waiver.
Right. So you
DD
wouldn't have to
waivers.
pay for an attorney that the parent or, the support, they could complete it themselves.
James?
So, Pat, you started to mention this, kind of previewed a little bit my other question here. That's okay. It's okay. You're going to post this on your own at some point. Pro se. But I did want to ask the question. We obviously can't identify individuals and families because there is a confidentiality component. There's HIPAA in regards to this. But I'm wondering if you can talk about, because when we talk about these services, it's really about treating families with compassion and providing some level of assurance. And, you're getting families calling, emailing, I don't know what to do. And hopefully by the time we finish that conversation with them, they're in a better place. I'm wondering if we can talk a little bit, de-identified, about some of the success stories as far as our transition supports go through DCF.
So I can say we were working with DCPMP that a parent passed away and there was really no one involved. So DCPMP obtained custody. And then when the youth reached age 18, 19, DCPMP reached out to the guardianship designated email and said, hey, the adult sister's involved and she wants to become guardian. What do we do? And we said, this is fantastic. We don't need to look at a BGS state appointed guardian. Let's support the sister become a guardian for her brother. And we were able to successfully do that by having team meetings, emailing resources, and it was great for the brother to have his sister. I had another youth. She became hospitalized in a psychiatric adult facility. Her mother had an intellectual disability herself, so she wasn't there to step up to become her guardian. So in that situation, we were able to submit a BGS referral, and it was approved, so she was able to have a state-appointed guardian to assist her. And then DCPMP and the Care Management Organization were able to close out, knowing that she would have someone, when the time comes to help her make those decisions.
Yeah. Yeah, and I gotta imagine. So the fact that we have state-appointed guardians for children and youth, or young adults in this case, that don't necessarily have someone they can rely on to help them make those decisions into adulthood, I think is a fantastic thing, because it gives people an outlet to have a sounding board to be able to make their decisions. But when you can empower family, and I think this goes back to like that emotional, like if you're supporting a young person with an intellectual or developmental disability, I gotta imagine going back to this idea of isolation, powerlessness in the face of like the big bureaucracy of state government. I don't know where to turn for help. Getting the tools that you need to be able to advocate for your loved one has got to be a really empowering activity. It's got to help the family kind of weather through some of the stress that comes inherent with supporting a family member who has these special needs.
Oh, definitely. I mean, even just being here, answering the call, right? And just listening to the parent kind of decompress, and we're meeting them where they're at and letting them know that they're not alone. and that there's support and resources available.
You do that a lot.
I do.
You do. In fact, we were just in the kitchen over here waiting, and you had an email come in on our work phones, and parents are texting you back.
Yes, and we try to communicate with parents whatever's most comfortable for them.
Sure.
Meet them where they're at, like Denise said, and really try to see how we can help them. A lot of times parents come and they said, I just got an autism diagnosis. I don't know where to go. I don't know what to do. What services do you offer? So we kind of guide them through that process. We look them to our system partners, also with Autism New Jersey, which is another great agency that we partner with to provide services and resources. So it's a lot of, like you said, like meeting them where they're at and giving them support, because really they are their biggest advocate because they know their youth, right? Like youth with IDD are not a monolith. Like they're not all the same. They don't all have the same needs. So we really need to look at each case individually and meet the parent where they're at and kind of give them all these services that they need. And they know their child. They know what they need at the home, what will work for them, what won't work. So it's important. I think we do a good job at CSOC to really listen to parents and try to incorporate services and find providers that can meet those needs.
Yes, very much so.
So my last question, as we think through the transition supports that we make available right now, and I mentioned that a lot of this has come in relatively recent times. What are some of the next steps or the next things that are coming to support transition? And who are we talking to in order to I know we mentioned the ARC, we mentioned Autism New Jersey, we mentioned our FSOs, but I'm wondering, who are we talking to specifically to design a transition support that works? Children and youth with intellectual and developmental disabilities are not a monolith, but we need a system that supports all families and all needs. So who are we discussing this with to be able to advance our system forward?
I would say the biggest one we're working with is DHS DDD, the Division of Developmental Disabilities, because they have the same issues that we have because especially when we get them at like 21, 20 and a half, we just want to go, oh, why couldn't we have gotten you earlier?
Yeah.
But our biggest thing right now is to talk about how do we get them earlier? How do we get these youth that turn 18 and that know that they need, or the families, they need to do something different from what they've been doing since a child was born? So we talk a lot with DDD, and like they have come up with the DDD Adult to Transition Life, and they've come up with, that's a whole nother little, I don't want to say agency, but a whole nother unit that is within DDD, and that's what they do all day from like 9 to 5. They have this help desk, and so we provide that email to case managers, to families, and they are able to at least go to that. And what else do they do? They do the presentations a couple times a month.
Yes, on Thursdays and webinars.
Yeah, they do one during the day. They do one at night. You can go on, and we're always sending them out flyers on when these are.
And they're on different transitional topics.
And we also attend those trainings so we can learn more and we can learn how to support families and youth transitioning. And also the data sharing that we do. We're really working with DDD to be able to share data. So like Pat says, when they come to us and we learn about them, we know, okay, they're 18, they're going to be transitioning soon. We get that information over to the adult system so they can get on their radar and know what next steps. So we try to really do kind of behind the scenes work to help the family, be able to guide them and help them transition smoothly. So we do communicate with DDD a lot, back and forth. They'll reach out to us if somebody reaches out to them and the youth is 17 or 18. They'll reach out to us to try to connect. So that's mostly the work we're doing is we have meetings with them regularly. We attend the trainings as well so we can learn how to process and help the families go through as well.
Right. Like last night I was, something came in and I said, this caseworker, and I look up. So then what we all do is we look up in the systems. Where is this youth? That they brought us. Okay, we have a date of birth. Now we look up the youth across the spirit system, the cyber system, and we see, okay, let's look at what is going on in their life, what the parent is saying, what the caseworker is saying, and how can we help? So that's when we pull all the information together and we communicate with DDD. We have contacts at DDD Intake. They have their own DDD Intake offices. They're in the 8 regional offices around New Jersey. And then we communicate with the supervisors and directors there and say, this is a youth that could possibly be coming to you. Right now, they're DD with us. So they say, okay, Pat, this is who we're going to assign it to. This is the regional office we're going to assign it to. And this is the worker, with the intake worker, we're going to assign it to. So then we pull that in and we say, okay, there's our DDD intake contact. Then we look at the DCPMP worker, and I usually put on the supervisor as a CC. And then we look at the CMO, and we look at that worker, and then we look at the CMO supervisor, and that goes there in the CC. So we have the 3 workers right on the top line, the CMO, the DCPMP, and the DDD intake. That's when we send the email, and we coordinate all those names, and everybody collaborates about this youth. And then it's not like our unit, we don't forget about them, but now they're connected, and that is our job. Or that is our job in an administration within CSOC, within DCF, is making connections, helping families and especially caseworkers navigate in the system, because as you said, Jason, before, it is overwhelming. It's overwhelming for parents. It's overwhelming for resource parents. It's overwhelming for caseworkers. And it's overwhelming for, especially I look at DCPMP caseworkers. So, and that's kind of the blessing, is that Denise has been with CMOs and DCPMP. Lourdes has been with DCPMP. I was with DC when it was DIFUS. Sorry, edit that.
It's okay.
I was 25 years ago, so I was with DCPMP then, and so you're right. We really try to bring that compassion and understanding to everyone that emails us. We don't wait for it. We're not just saying, oh, we'll take care of that next week. We're really on top of this. And then another collaborative partner is DMAS, right? The Division of Medical Assistance and Health Services, because that is the heart of Medicaid. So that's who our DCF Medicaid specialists reach out to. And then we have DCF Financial and Reporting, and they have what's called Title IV reviewers, which is basically block grant money that came in that helps DCPMP workers with the Medicaid situation. And those that are in our resource care. And they're able to reach out to the Social Security Administration and see what they have and what they can apply for, whether it's through New Jersey Medicaid or federal Medicaid, which is the SSA, the Social Security Administration. Yeah. So, in a nutshell, I would say we're really working with DDD a lot, because they don't want to be surprised, and then we're like, could you expedite this? And we don't want to ask them to do that. We really want to try to get them in advance. And that way, again, it is seamless, and the youth is either going to, our DCF youth is either going to what? Out of home, which is what DDD calls residential. They're going to stay at home, and then DDD puts supports in the home to help the families. So they're in also vulnerable situations. So we really try to work with whoever emails us or calls.
Well, thank you, Pat, Denise, Lourdes, for coming on the episode and talking about the work that you do. I think when you think about the connections that you're making for families who may feel disconnected, and you're thinking about helping them along their journey, I think it is so vital and connected to the vision that we have for all New Jerseyans to be safe, healthy, and connected. So thank you for sharing your information, and thank you for all you do to support families. And
thank you for having
us.
Absolutely. Absolutely.
This is great.
So next month, we talked today about the connections that we're drawing for families within the state system as they navigate supports to deal with intellectual and developmental disabilities. Next month, we're going to be talking to a different type of connection, and that's our stakeholders that work with us that aren't a part of the organization itself, that aren't a part of DCF, but are advocating on our behalf or advocating for us to do better. So we're going to be talking to the New Jersey Task Force on Child Abuse and Neglect and what their vision is for the state of New Jersey. Not just that all New Jerseyans can be safe, healthy, and connected, but how do they help in that regard? So whether we're talking about connecting families or connecting organizations, it's all in service of making sure we have the best outcomes possible for children, youth, parents, everybody. So on behalf of my producers in the Office of Communications and Public Affairs, this is Jason Bukowski, and tune in next month for more DCF on the Air.